Janelle Marie. Welcome back to Body Beautiful. With us today, we have plastic surgeon Dr. Joseph Mele. We are talking all about plastic surgery, and of course, any advice we give you today, you want to consult your own physician as well. Dr. Mele, thanks again for being back with us.
Thanks for having me.
We were talking about mommy makeovers in the segment before. I just wanted to mention, a lot of women come in that have not had babies,
sure,
and can get the mommy makeovers, of course, right?
Well, yeah, in a situation where someone has gained weight, it kind of does the same thing to the body. Everything expands, and then when they lose weight, it shrinks up again, and sometimes that skin is excessive, similar to pregnancy.
Okay, so interesting to know, good to know. Let's talk breast augmentation only.
Okay.
Who's a good candidate for that?
So breast augmentation, I mean, the ideal candidate is someone who has a nicely shaped breast, who just wants to be a little bigger.
Okay.
And I think that works very, very well, because then we're not worrying about doing lifts or changing shape. Just, we already got the shape we want, just want to be a little bit bigger. That's the ideal candidate.
So augmentation, just bigger. So in other words, what about if they want to be a little tighter, bigger? Then they have to incorporate the lift?
Not necessarily.
Okay.
It depends on how the skin is loose and how much volume we're putting there.
Okay.
So there's lots of folks who've had babies, lost volume, and just want to get back to where they were before, and we can put that volume back without having to do a lift.
And what's the recovery time on breast aug?
Breast augmentation is about a week. I think most folks, by the first day or two, it's pretty sore. By the end of the week, it's still sore, but to the point where you can get back to doing what you need to do. And
where do you put the scars when you do a breast aug?
It depends a lot on the type of implant. So with the silicone implants, they come pre-filled. So they're a little bit larger, and often the area around the areola is just not big enough to put the implant through without damaging the implant. So we'll go underneath.
Okay.
There's also an advantage underneath. It seems like we get a little bit less capsular contracture, which is tightening of the scar around the implants tighter than we want it to be.
Right.
With the saline implants, they come empty. So you can put them through a smaller incision. So a lot of times we were putting those in through the periareolar incision when that was the only thing we had available. Nowadays, about 80% of the augmentations are silicone, about 20% saline. And the folks are using that mostly for women below the age of 22, because the FDA has said until you're 22, only saline can be used.
Okay, so now silicone's most popular.
So, yes.
What are the different implants? Because we're hearing about the gummy bear implants and all kinds of things, so give me a rundown.
It gets confusing.
It does get confusing, because which ones do you use?
I mean, the big differences are the silicone-filled implants and the saline-filled implants.
Okay.
Within the silicone implants, there's different amounts of kind of cohesiveness or stickiness of the gel. So a very cohesive, highly cohesive, or what they also call is the high-strength silicone gel, if you were to cut it in half, it would stay in that shape.
Okay.
So I have one in my office. I show people all the time. I cut it in half, probably 2 years ago, 2.5 years ago. It looks perfectly flat, like I just cut it in half. If I squeeze it, it kind of moves, comes out. When I let go, it goes back to that same shape. So it has memory.
So is that
with the other? There's other implants that are cohesive. But if you were to cut them and kind of hang it up, it might take an hour or so, but it would eventually move.
Okay.
And the older implants, the ones especially before 1985, were almost like liquid inside. And those are the ones that really gave silicone implants a bad name, because once they leaked, the gel would start to move. And if the body sees it there, it'll make more scar. And it doesn't cause cancer or cause lupus or all the problems they were talking about, but it can be disfiguring if that scar is not taken care of sooner than later.
So how do I know, how does a person, when they come into your office, know what size they want? Have they already decided what they want? Because I know you go by CCs, so how does that work when you're ready to make a decision?
Most patients don't come in saying, I want X number of CCs. And even when they do, I want to go backwards and start at the beginning again. A lot of folks will bring in pictures of the size that they think is good, or they'll say, I'm a B cup, want to go to a C or C plus, D minus, somewhere in that range, and that helps me, because depending on their body type, I need to use different CCs. And the same size looks completely different on different people, depending on how much breast tissue they're starting with, how tight the skin is, how big they are, how tall they are, how wide their chest is.
So it all makes a difference. Well, let's take a look at some pictures. Number one, that's a very nice one.
So this is just breast augmentation. Again, nice shape to start with.
Very nice shape.
Nipples in the right position. Just wants to be larger.
So you didn't have to do anything else except augment that? You didn't have to lift?
Make a little incision underneath the breast.
Fantastic.
Make a little pocket, slip the implant in. Works very well.
Does it matter if, when you put the implants in, you know how some have a definite size cleavage, or they don't, they're closer. Does that depend on the woman's chest, or is that?
A lot of it does.
Oh, okay, because I wondered what that was about.
Yeah, even our sternum, there are different widths to the chest plate.
Okay.
And if you have a very wide sternum, the nerves for the chest come out on the side of that, so you don't really want to put the implants over the sternum. You may end up with numbness in the middle.
That, I always wonder how that works.
And this I always say is the backwards tan.
Yeah. Totally.
Usually there's more tan afterwards,
Exactly.
but she obviously did this towards the end of summer, and then the winter came. But same idea. Wants to be, you know, B, C cup,
She had
not big.
it seems a perfect shape before.
She's very athletic. She wants to remain athletic. She doesn't want her breasts in her way, but she wants to fill her swimsuit and feel more confident in that, and that works very well.
You know what looks great about that is she probably didn't start with a lot of body fat to begin with.
No.
And then you put the augmentation in. Sometimes you can see the implant, right, because they don't have a lot of body fat, but that wasn't the case
so
there.
I went under the muscle, which helps, gives us an extra layer.
All right, here we go. This is another
So here's
lovely
what you're asking about the cleavage.
Yes,
so
yes.
Her cleavage is a little bit farther apart.
Yeah,
but her sternum wasn't that wide, so I could cheat and move it over a little bit.
Wow.
But sometimes the breasts are at a breast apart. And it's very difficult to bring that back together. So,
but those
and I always tell people
natural.
it's not natural to have cleavage without a bra.
No.
So even if they're farther apart in a bra, usually we can get them to come together nicely, and certainly more easy with the larger volume than it is before having the augmentation.
You definitely want them to look natural.
Yeah.
Our last picture here.
So same thing here. So
those look great.
So she's kind of on the borderline. Maybe could have done a lift to bring the nipple up a little bit. But wasn't in her desire.
Really?
She was very happy with
the placement of the nipples. She didn't want any more scars, probably.
And you can tell normally her nipples are low. That's how she was born. That's how they are sometimes. And I'd say, you know, if it doesn't bother someone, I don't fix it.
Yeah.
You can also see her right breast was higher than the left.
Yeah.
So what I've done is try to lower that fold on the right side and get things to match better.
I think that looked great without the lift, so very good.
Sometimes you don't need it.
Sometimes you don't need that lift. All right, for more information about Dr. Mele, you can give the office a call at 925-943-6353. Check them out on the web, drmele.com or sanfranciscobreast.com. We have lots more to talk about here on Body Beautiful. We'll be right back.